Hello, everyone. Welcome to Transforming Education in the Time of COVID-19, Lessons We're Learning. Both the chat and Q&A features will be available throughout this session, so please ask questions, make comments, and stay engaged. Thank you for joining us today and for attending this session. Now I'll turn it over to the moderator to introduce today's panelists.
Great, thank you. We're actually going to run a poll briefly to see who's in the audience, and I know some folks are still joining us, but we'll launch this poll and just let us know who you are. All right, we've got about 80% voting, so I'll end the poll and show you the results. We have 21% of our participants are CEOs, 42% are CPD or education directors, as well as some communications and marketing folks and other. And I expect we'll have additional folks join us. If you would like to put your role in the chat, that will help us get to know you. Thanks. Now I'll turn it over to Damon.
My name is Damon Marquis. I'm the Chief Learning Officer of the American Academy of Dermatology and your host. CMSS has pulled together an astounding panel of 6 people who have been in the midst of transforming education in the world of COVID. The title of this program originally was Lessons Learned, and when we started planning this, we were on the call and said, we're learning, so that's why we changed the title. I'm going to hopefully have a panel that is very interactive, and we'll try to cover a lot of the topics that I think you're all interested in. We will, of course, talk about changing our major annual meetings, but also we'll talk about education programs in large part beyond the annual meeting. First, I'd like the panelists to introduce themselves. Anne, you want to introduce yourself?
Sure. Hi, everybody. I'm Anne Grupe. I'm the Director of Continuing Education with the American Society of Clinical Oncology. We held our annual meeting in May, at the end of May. And in fact, we actually split our annual meeting this year into 2 parts. Our science program was held at the end of May, and our education program was held at the first weekend in August, although we had 1 registration fee to cover both. We ended up setting a record for registration at close to 45,000 people. And of those, we had only about 2,500 who registered after the science meeting happened. So really still focused around the specific dates, even though we were on demand.
Great, thank you. Rebecca?
Hi, Damon. I'm Rebecca DeVivo. I'm the Associate Executive Director of Education at the American Academy of Physical Medicine and Rehabilitation. And our meeting is going live a week from Sunday. So we are in that crunch time just before the annual meeting. So unfortunately, I don't have registration statistics for you yet, but come back in a couple of weeks and I'll let you know.
Great. Steve?
Hi, everyone. My name's Steve Folstein. I'm the Director of Education at the American Academy of Allergy, Asthma, and Immunology. Our 2020 annual meeting was scheduled to kick off on March 13th. We wound up having to cancel 5 days out. And so we selected a small subset of that content and created online enduring content for people to access asynchronously. We're now well underway planning for our next year's conference, which will be at the end of February 2021. And over the summer, we've gone from planning for a live event to planning a hybrid event to now we're planning a completely virtual event. But registration hasn't opened yet, so we don't have any numbers yet to share.
Thanks. Jane?
Hey, hi everyone. I'm Jane Radford. I'm the Director of Education at the American College of Medical Genetics and Genomics. And we were to have our meeting March 17th through the 21st in San Antonio, Texas. And on March the 8th, we canceled our meeting. And we couldn't spin quick enough to go to a virtual meeting. So what we did is we had everything recorded, put things out there for what we call the digital edition. And we had a series of live webinars, to cover up all of the, it lasted for about 2.5 months. We had flipped some numbers, and we'll share some numbers with you later, but we ended up having over 2,000 attendees that are in our digital edition. It's been very successful. And in the webinars, we had over 3,000 attendees. So our next meeting is going to be in April in Los Angeles in 2021. And right now we're planning a hybrid meeting. Yeah, we'll see.
Thanks. Deborah?
Hi, I'm Deborah Samuel, Director of Live Education Activities at the American Academy of Pediatrics. We had our national conference, our annual meeting, almost a month ago. We had record professional attendance of about 14,500. Since then, we've had our registration open in the ensuing weeks. It ends later this week. And we've had so far about 350 plus that have registered after the meeting to view the content, which will be available through January. We've had some of our meeting consisted of many on-demand sessions, approximately 180 on-demand sessions, 30 plus live sessions, plenary sessions, and subspecialty focused sessions as well for our member sections, sections and councils. And overall, we've had some of our on-demand recordings be accessed 3,000 plus times. So there's a range, but obviously we've had some that have been that high. Credit claims, we kept our credits in the same range of what our live meeting had been. So it had been in the 40 plus range for credits, and we maintained it at about 42. And so far, the average amount of credit that's been claimed has been about 28 credits. So again, it's in line with our history where people are not claiming the maximum, and we chose not to designate the maximum amount that we could have.
Great. Nina.
Good afternoon. My name is Nina Taylor. I'm the Vice President for Learning and Education for the American Society for Radiation Oncology. On April 30th, I pitched to our Board of Directors a new plan given what was going on with the pandemic. We were slated to go to Miami, and the Miami Convention Center at that time was a 450-bed hospital. So it just became imperative that Miami, I needed a new plan. Miami was not going to be ready to host our conference, which usually yields about 10 to 12,000 attendees. And so we made the switch to virtual. So our meeting was October 22nd. It ended 5:30 yesterday. So we had a little over 5,400 registrants. I made an early decision as well to keep full registration. So the registration rates they would have paid in Miami were the same. So, we had over 110 exhibitors. I kept the entire program the same. 1,700 posters, over 240 educational and scientific sessions, and essentially brought Miami to everybody's living rooms. So far, we have over 650 people that claimed credit. We did do the over 200 plus credit. Clearly, it was more of a marketing ploy than people actually, going to claim over 200 credits. So far, we have 3 people that have claimed over 100 credits. So we'll be tracking those metrics as we have just closed. We're keeping the site open for 30 days to allow folks to continue to peruse and learn. So I'm tired.
Which is why I'm going to start with you. This is a question for everybody, but I really would, because it's so fresh. I mean, post-traumatic stress close. That I want to start with you to just talk about instructional design. We all know, we're educators, that instructional design impacts whether people actually learn, whether they're engaged, and whether they walk away with valuable information. So this is for all of you, but Nina, I really would like for you to start. What did you make any changes in instructional design or the planning of the program based on the fact that it was going to be completely virtual versus face-to-face? And in your answer, could you also talk about any ways you made this an interactive experience?
Yeah, so I leaned a little more kind of outside of what we learned in medical education and leaned more into sensory design. So I had 4 different types of educational models. So one was, of course, live. So essentially live doing something like this with panelists or a speaker. Simulive, which was pre-recorded and had our faculty either chatting or responding to questions that were coming in, recorded, pre-record on demand, released at midnight, allowed us to get a bulk of the content, especially from folks that we knew might have issues with VPNs or even being available at that time, getting some of that key content in, and then poster presentations. But we had folks narrate their posters so that we could, people could click on each little button on their little poster and they can hear the author's voice and kind of bring some of that human-centric learning to the platform that we used. We really focused on engagement, interactivity outside of just everything that you know with like the apps, right? And so we did kind of like power networking, so moderated chats, not only with faculty, but invited guests. We even sent out invitations to some of our committees, you know, especially like our Health, Equity, Diversity, Inclusion Committee, given everything that's happened outside of the pandemic, to bring in some of those hot topics. So we hosted things in our networking lounge, some of our other areas that were inside of our quote unquote convention center, and did things like speed mentoring, right? People still wanted that face-to-face time. We leveraged our social champions. If you take a look at our hashtag Astro20, we were like kings and queens of using the GIFs, but that social learning was huge. And even folks that wanted to do deeper dives, they sent out their own Zoom links and had study groups pulled together. One of the, I think, key challenges for us, we were already going through the scrimmage of helping our faculty teach in new and unique ways outside of death by PowerPoint, but this really made us move the needle even so much more. A lot of our energy went on, you know, how can we help our faculty deliver this content in a way that would resonate? And then I think as we were talking is like, how do we incorporate more hands-on learning? So we incorporated e-contouring, we did more of that. You know, asking other organizations to come in and talk about the key science from their meetings. So I know ASCO came in and talked, as well as ACR. And so some of our kind of key allies were able to talk about what happened in their show. It didn't have to be related to radiation oncology, but it gave a voice to everybody that had something to say, right? And it was just compelling. And I think that was what we really leaned into, is just making sure that the content was not only informational, but it really had, people were wanting to talk about it, engage in it. So.
Great. I want to open it up for everybody to respond to this, but I'm going to do something nasty. Jane, you didn't have a lot of time to turn around. What did you do?
We fortunately, thank goodness, had some systems in place. So we were able to use our learning management system, and were able to get all the content into that and build courses, if you will, build the digital edition, if you will, inside of that. My staff, the people at ACMG, I had a whole team of people that were helping with speakers all of a sudden recording their sessions, keeping things on time, because you know they couldn't just like start talking and not stop. You know, keep people on point. The biggest thing was putting together the webinar series and spinning that quickly. The meetings team was turning everything over so rapidly. They were really under the gun there with converting, if you will, registration fees to the digital edition. So we can sell the digital edition for anybody that did not register for our meeting. But what they did is they were able to reach out to everybody that did say, you know, this pandemic's going on, here we are, and they were able to convert a large percentage of those registration fees over to the digital edition. So we had so much going on. It was really, really quite challenging, and we came through. I mean, I'm very, very thrilled with the numbers that we had and serving our membership, as well as reaching all of the non-members too that we do for this. It was good.
Other panelists and what you've done from an instructional design perspective?
Go ahead, Deborah.
Okay, thanks. We made the decision in June to cancel our in-person conference and convert to virtual, and it was about a week or so before our conference planning team was going to come together, our members, and plan the 2021 conference. So instead, we shifted focus to focus on the conference. 3.5 months later, we engaged the planning group to decide and look at the current program and then help identify the topics that would be most appropriate for live scheduling, like during the live portion of the meeting. Obviously, we took our entire program and really tried to launch it all as we could. We knew that we couldn't do hands-on. That wasn't really going to be feasible for us this year. Interactivity, in terms of, we have some sessions that are designed strictly for more interactive role play, et cetera, that we at the time did not feel that we could make those happen and give them justice as they were envisioned. So we took some sessions out, but largely with the rest of it, tried to prioritize the topics that would be appropriate, and offered up the other ones as on-demand options. That didn't mean that they weren't important. It was just trying to accommodate the entire meeting that was already planned into the span of time that we had with the planning group to do that. We of course adjusted our scheduling and content to ensure we addressed hot topics, COVID, fighting racism, diversity, inclusion. I mean, those are all major themes in our live programming, and really had an impact on our members. It was in the poster hall too. I know, Nina, you talked about your poster. We had virtual poster halls, so that was very successful as well. Same thing with recordings. So we knew we couldn't do some things, and we adjusted as quickly as we could with the rest.
I would say we followed almost exactly the same process that Deborah had in terms of converting our program and selecting the live sessions that were most appropriate, and then doing the rest on demand, as well as the posters. The other thing we looked at is we also shortened our sessions, so that, because we had a lot that went 75 or 90 minutes, so we capped all of them at 1 hour, because we felt that in a virtual setting it's hard to have sessions longer than an hour. And we took some sessions out, like our community sessions, and we're rolling those out sort of in the Sunday through Thursday leading up to the main program, to alleviate some of the overlap, and to spread things out a little bit, and to keep things more in evenings and on weekends. So we're actually starting with some of our pre-programming on Sunday, moving some pre-course sessions to Monday, Tuesday, Wednesday night. And then most of our main programs can be Friday, Saturday, Sunday. So we did think about that as well, in terms of not exactly replicating the schedule of a live conference, and to be more conducive to people who are in a work setting and juggling more than one thing at a time.
Yeah, so I'll piggyback on both of those comments, because one thing that ASCO did for its science program that I think worked really well is we typically had in our live conference highlights of the day sessions, where they were 90-minute sessions with kind of rapid fire, here's what happened the previous day, and oral sessions. And what we did instead for our broadcast program was we instead had track highlights sessions at 30 minutes apiece to represent every single track in our science program, because we recognize that in a digital format, you're not going to dedicate the same kind of time, and it's not going to be the same kind of experience as going to a poster hall, as sitting in an oral abstract presentation. And so we really wanted to provide, again, in that shorter digital bite, an opportunity for our learners to really understand some of the key highlights in the science in each of the particular tracks. And I think that went really well. Interestingly for us, after we do our main evaluations, we also do our impact surveys to look at practice changes. And of course, it's self-reported as always, but we were really encouraged that our practice change rates are still over 70% for respondents. So even moving from that live to digital format, we're still impacting people and changing practice at similar rates.
So we do have a question before I go on to the next question we had all discussed. If anybody is comfortable with talking about how you priced this year's meeting, and does that impact how you think you're going to price next year's meeting, assuming that's going to be virtual as well?
Yeah, I can, I think I mentioned use the pricing from that I was going to do at the live meeting for the virtual meeting, and actually had a number of conversations about that, even, talking to some external consultants. And what it came down to was I knew that it was going to be an unpopular decision because of where I was placed, in the year, right? So I'm in a fall show. Most of the shows before me were free, and that I was going to get dragged regardless, right? But if I took a look at, my LMS programming, the virtual meetings that went before, what I was delivering as far as content, I didn't want to undervalue what I was bringing forth. And then from an organizational perspective, my organization couldn't have taken that financial impact, to be quite honest. And so I needed to keep registration at a certain level. I needed to sell the exhibit hall. I needed sponsorship, and I needed all these other things. And so, and then there was that uncertainty around insurance as well, right? And so, yes, we did have the communicable disease rider, but also where we were placed, we were unsure if, Miami was of course kicking and screaming all the way, if we would get the coverage if we did have any significant losses. So, for next year, I will be evaluating, do we, extend early bird rather than reducing rates, because I, have folks that are going to go back to hotels that are going to have some sort of pricing increase. It's a difference between Miami pricing and Chicago pricing. And then when folks did get to the experience, they realized that they did save money. They didn't have the, the flight, the resort fees, and all this other stuff. And they got more, right? And they weren't tired, and they still felt engaged with the content as well. And so I don't think I have much of a battle, but I do think that where I set the expectation of what you got for the money, we might have to work on that.
Yeah, we followed a lot of the same thought processes that you did. We're later in the year, but we were in California, so we had the benefit of having probably a little bit more advance notice about being able to cancel our meeting and having some, we don't know, we haven't had the meeting, but we have some reasonable expectations of insurance, covering our deficit. So for 1 year, we cut our registration fee in half for this year, but we've already started our conversations about 2021 and looking at both the live and the virtual, and should they be the same fees, should they be different fees? And that's where a lot of those conversations came in of, do you want to incentivize one or the other? Do you want to penalize one or the other? Because people who are paying to go to the live meeting are already paying a lot more in terms of hotel and airfare. Should they also be paying more in registration fee? On the other hand, if they're already paying that much, registration fee probably isn't the main factor. So I think where we are right now is certainly returning to our regular level of fees for the live meeting. We think that if we stay at a lower level for more than 1 year, it's going to be very hard to go back later. So we're going to return to our typical pricing for the live meeting. We're still battling with the virtual, but there's, it's the same content package. And it's sort of just a decision of how people want to experience their meeting to some extent, because we've really come a long way in doing that. So I think we're either going to be similar in price or not much lower. Like I think 20-25% lower at the most is sort of where we are now. I do have the benefit of seeing what all of you do before we get to my meetings. So I look forward to using data from your meetings to help inform our decisions. But that's where we are right now.
I tell you, one of the things that we did when we had to kick things off was we offered just a couple of free webinars, and then everybody had to pay for everything else that was going to be in the digital edition and all the other webinars, kinds of things. So we kicked off with just a couple of free webinars. But as far as pricing goes, we don't really see a lot of change from what we've been doing.
We've gone a different way with this year because, like I said, it was such a last-minute cancellation. We picked a small subset of the program to capture and record, make available asynchronously, significantly reduced the price. Some of that was, like Jane, some of that was made available complimentary. Some of it there was a small charge for. Now for 2021, as we've moved to going to a completely virtual format. We're again reducing the price. I mean, it's also a reduced program. It's not as much content as we would normally give in a live program, in an in-person program. So that was part of it. I think part of that decision was also the realization that there's not all of the other event experiences that come with being there. So if people aren't going to get the networking and the mentoring and all of that in-person stuff that happens outside of the session rooms in the convention center, that we shouldn't charge the same rate. So we're looking at about half of our normal registration rates for next year.
For our meeting this year, we reduced our reg fees about 50%. And one of the changes that came based on the fact that it was virtual was that we got rid of like our 1-day fee or special course fees that we would have charged if we were in person. And so it was a more simplified pricing structure. And I think that's something we'd like to continue in whatever we do for future of in-person, hybrid, virtual, et cetera. It made things a lot easier. And I think it was more, simplified for our attendees as well.
Just offhand, did you guys have early bird fees for the virtual conferences? Because we did not, and we'll be looking at whether to go back to that next year.
We did.
We had early bird and we tied it to giving. So we chose 2 Miami area centers that, really worked with patients in that area to donate to. So that kind of helped boost folks to actually give in the early, and it helped us with our kind of early traffic and numbers to get eyes on the site as well, so that they know what to expect. But we were able to see a great return on early bird. We kept essentially the 15-week reg process.
We're not doing early bird for 2021, but that's because most of the sessions that are presented in real time live are also going to be captured and put online after, and we're keeping the entire content package, both everything that's pre-recorded from the outset and everything that's presented live and then recorded. All of that's going to be available for 12 months. So we're just looking at it as one package that's available for a year. You might interact with it in different ways, but it's just going to be one consistent pricing throughout that year.
Great. Another question that has come in that I think we have all discussed in different environments, but is it better to put all of the education all in a compact set of time like you do for your annual meeting, or to stretch it out over a week, 2 weeks, a month? Have you thought about that? And what do you think? I don't know that anybody has done that, but what are your thoughts on stretching it out?
So I can tell you what ASCO's experience was, because we still had our meeting dates. So we had what we called a broadcast program for the typical live meeting dates that we had, but then all of the content was available on demand. And we were wondering in particular if there would be some kind of sustained engagement between our science and our education programs, since one happened at the end of May and one happened at the beginning of August. What we found was that learner behavior, at least for 2020, was very clustered around those dates. I think that even in a virtual environment, and I mean, CMSS is a great example of this as well. Community is still really important, and community is still part of why people come to meetings. And so what we found, actually, we may have crashed our servers on Saturday afternoon for our annual meeting because we had so many people joining at the same time. But we had that peak during those meeting days, and then we had this significant drop off. And we had we had an uptick for our education program, and then again a drop off after those dates. So I think, even though we have the content available, like others here, we have our content available through the end of the year for registrants. I think it's really hard to sell that, session another time, I'll go back and do this. And so, we are still going to offer the on-demand content for sure, but our experience has been really stay focused around those meeting dates that you're advertising.
Yeah, so I added 2 days in the beginning, and we had like a soft launch day, just, to test load, to get all the ducks in the row, an exhibit hall only day where content wasn't released. And then I would release the on-demand pre-recorded midnight, right? So it was a benefit to everybody that was overseas. So they were actually seeing content first. And then I kept the live kind of dates, like a schedule of programs. And I think it helped the staff that were actually supporting those programs to not feel overwhelmed, to still be able to support faculty in that time and still have that feeling of a live show, right? So we had a little countdown clock, people would get excited, you could see them lining up behind the doors, but it still gave that feeling of a convention. So I had about 14 rooms in a convention center where people felt like they were roaming the halls, right? And so we wanted it to feel like the annual meeting, and I think that helped people get into a learning feeling where they wanted to be able to connect and talk about anything that they had just witnessed in a science or education session.
So I want to go back to pricing, and then I'm going to go on to platforms. So one more question that's been raised is when you lowered your registration, there are some organizations that set registration rates by number of credits, right? And so the question is, when you lowered your price, did you take into account the number of CME credits that were being offered? Was there a correlation between that? Like each credit's gonna be worth X amount of dollars, or did that come into the conversation at all?
So I can piggyback off Deborah's initial comment at the very beginning of the hour, where she said that when she took her program virtual, she didn't change the number of CE credits that she typically offers for the annual conference. ASCO went the other direction. So we offered credit for everything because we realized that people could technically participate in everything because it was on demand. So we jumped from around 40 credits for our annual conference to, if you put the science and education programs together, it was closer to 200 credits. What was interesting was, the answer is no, we did not price based on credit. But what was interesting is when we looked at our claim data, we found that the average number of credits claimed in 2019 was 18, and the average number of credits claimed in 2020 was 27.5. So again, learner behavior did not change all that much. People were still, they were doing a little bit more, but we weren't having these wild claims of, 150, 200 credits. So I think we're probably going to stick to that model, because even moving forward, the virtual component, now that we've got it, it's not going away, even if we go back to a live conference. So I suspect we'll continue with these 200 credit meetings, but it's good to see, at least preliminarily, that it doesn't seem to change learner behavior all that much.
Anne, can I ask, how much time did your participants have to access the content and claim the credit? Was it a pretty tight timeline for that?
So it's still open, to be honest, because the on-demand content is still there. People have until the end of the year, technically, to claim CE. I think we did have an initial push because we allowed a 90-day window for our MOC claims to get data to the ABIM. But interestingly, again, the learner behavior was kind of, I'm going to pick what I'm going to do, it, and I'm going to check that box and move on. So that even if they come back to the on-demand content later, it's not for CME credit purposes, it's for informal learning purposes.
Well, I think that was the point that I was making before we started up, that a lot of times physicians are not coming to check off the box to get the credit, but that they recognize that the content was created based on high quality standards, and therefore they can trust the education. So whether they claim the credit or not, it's certified, and therefore they trust it.
And I think, Anne, you sort of implied this, but I was wondering if others could comment on this, on the activity of people who claimed on demand really after the main event. It really dropped fairly precipitously. Is that correct? That once you're past sort of the live event part of it, that you're not getting a lot of on-demand activity comparatively?
No.
Can I ask a follow-up to that?
Sure.
You know, we have a history for the last several years where when we've had our traditional in-person event, we would capture a lot of that, make it available afterward as an enduring product, and it was available for 2 years. And we would have a fair number of people who would access that. And over the 2 years, we saw not a huge number of people claiming credit, to get back to what Ann and Rebecca were talking about, but there was definitely ongoing traffic through that in that post-meeting time. And so we've sort of built a tradition of that. Did you have that same pattern with your members in your meetings? And has the behavior with this new sort of virtual environment, is it different, or is it the same pattern carrying over just in a different format?
So I think, I'm going to answer with yes, and I don't know. And the reason why is because right now, I think, and I know we talked about this in our kind of our prep conversation, but our learners are still learning too. So this is a new environment for us, and this is also a new environment for our learners. And so I suspect that the behaviors that we see in 2020 are truly preliminary data. We have no idea if this is going to be the way they behave in a longer term, as they get more used to hybrid meetings, virtual meetings, et cetera. What we are seeing right now is that, peak participation happens during the dates of the meeting and then drops off. And you may have, little blips here and there, but nothing truly significant. What I wonder moving forward is if moving to hybrid meetings, moving to having more on-demand content will change the behavior of the learners and will force some changes on our end in terms of how we think about surfacing our content and making our content discoverable, so that our, for example, does our content need to be so closely tied to a meeting, or does it need to be discoverable based on a topic area instead?
Yeah, I would comment on that as well, because that's sort of where I was going with my question, Steve, because I think we're doing it a little bit differently in that we're going to give our content up for conference registrants up until February 1st. But then we're going to shut down the site and then launch it as a product for people who did not attend the conference. Or I guess they can also purchase it if they attended and still want access to the sessions they didn't get to. So for us, we actually went down the thought process of not really differentiating between live and virtual, or in-person and virtual, but really separating out the event from the product, because we did always have a product of our recorded sessions after the fact, and that was a completely different audience from who went to the actual conference. So we're sort of following that same logic. I don't know if it's going to work, but in the future, my guess is it's going to be similar, whether people go in person or virtually, if a hybrid event. I imagine we're going to give everybody access to all of the sessions in that scenario, so that it really doesn't matter which format they decide to go in, they can have access to all of the sessions. So the question is, for the people who do not go to the event, is it just giving them access? Or I think from a marketing perspective, we sort of thought, let's relaunch it as a separate product, give it a little bit more hoopla as its own thing, because it's a different audience, and look at it that way a little bit. Yeah. So that was the approach that we're taking.
Yeah. I mean, I think there's also some really interesting opportunities in this digital space for cross promotion. For other society products and society content that may not get the kind of traction that our annual meetings get as the flagship event. So are there ways that we can be thinking about the other content that we produce as a society and really start connecting the dots for our learners?
I think that's a benefit of virtual, right? So now that we're capturing a lot more than a lot of us perhaps did, there's a lot of redundancy that if we really look at it across our organizations, how many times are we educating on a certain topic, and do we need to do that, and are there other missed opportunities that we need to focus on? I mean, that's something that's come up to us in terms of whether it's just right now converting our in-person to virtual, as we have been and are continuing to do, looking at our own redundancy, but beyond that, with our current other enduring activities and books and publications, et cetera, that if you really step back, that's, you know, we could really take another look at what we're putting out there, because virtual is available. And to your comment, Rebecca, I want to just follow up. You know, our registration is still open. Our meeting content will be available through January. So we're still waiting on our data and what the pattern will be. We've had a few inquiries come from some of our constituents around, can I have that session? Can I post that session for my members? And can I share this little bit, you know, here and there? Right. And our message overall so far has been, well, the registration's open. It's, you know, we encourage you to register. You know, we want to push people to register. We don't want to, you know, we want to be careful that we don't set a precedent or we're strategic in how we do this, that if we give any indication of, oh, wait 3 months and you can get it for, well, you could get the content then, you know, we're setting ourselves up basically where our learners or our members would know that that's the model. And we want people to register. We want people to engage in the activities appropriately. And there may be some times that content could be peeled off a bit, but it was almost like a couple days later, we were starting to get these questions like, well, hold on, we'll have them register. Still there.
Well, along those lines, and we had a comment come in around marketing strategies for post-engagement, like what for the folks that, you know, you've had it out there for a while, what are you doing to continue to drum up traffic?
Really a marketing question.
Yes. No, I mean, we've done email blasts, we've done podcasts, we've done articles in our ASCO post, in our connection. I think the most interesting experiment, if you will, in terms of longer term engagement has been that we took our fellows lounge virtual. And we ended up doing, that has really, you know, I think it's nice because they're kind of they're a community already. Yeah. Within our larger membership. And so they've really taken to creating an online community where they can connect with experts, they can do mock interviews. So a lot of the things that we did within our Fellows Lounge, we converted virtually, and we've been able to do that over time to really support our fellows through the summer months as they transition, particularly the ones that are transitioning out of fellowship. Into their first.
And like Anne, we've been marketing again as well. Our meeting, it's still available. Feel free to register. Encourage people to do that. And we'll be transitioning, you know, into more messages in terms of communications. Don't forget, as a registrant, you have access to the content through January. Don't forget, you know, so it'll be, you know, it's dual messaging now, but obviously once the registration period ends, we'll continue the messaging to our current registrants about everything the conference platform offers them.
So I want to jump in because I knew this would happen. That's question one. So I do want to ask a quick question of each of you, and I'm going to ask you to be very concrete. Like, you've been through it or you're about to go through it. If you're thinking about 2021 and you're thinking about a platform you're going to use, what are 2 or 3 what kind of functionality do you think you're going to be looking for that either you liked this year or you think you could improve on for next year in any platform that you're going to use? And once we're done with this discussion, then I want to move quickly into big picture, your education program. But I really would like to get some feedback on functionality, because I think people who are watching this are facing the same thing of what kind of functionality do I need?
Well, we just finished that process for our 2021 program. And it was a challenge because there were a lot of competing demands within the organization. I fought pretty hard that we needed something that would support our educational aims, going back to some of the earlier questions that Nina was talking about, instructional design and session format and interactivity and those kinds of things. And what's happened is that we've wound up picking a main platform and we're having to supplement it with a couple of outside things and sort of Frankensteining this thing together that's going to provide the mix of functions we ultimately needed to serve the organization and the whole event. We didn't find one that did everything.
Right. Right.
For me, API, good reporting, and understanding of GDPR, and customization.
My 2 keywords would be interactivity and navigability. When we got our evaluation results back from our learners, those were the two things that bubbled up quite clearly, is that they want to have more opportunities to interact with each other, not just within the session, but external to the session as well. And they need something that is intuitive. You shouldn't have to be technically savvy to navigate an annual meeting that's virtual. And so that's what we're focused on.
Yeah.
I'll say user-friendly, which is really the same thing. And for me, the other one is bandwidth, both in terms of staff support and infrastructure.
I would say the same thing Ann did. I think our platform this year, anecdotal comments so far from attendees was that it was easy to navigate, which was great. We did not have an app. It was, online, so however that people access that is how they got there, but we did not have a specific app, and it worked overall fairly well in terms of where to go, where to find things, in relation to interactivity is the other thing too. Obviously, we had a very healthy discussion board discussion in a lot of our sessions, and the attendees were talking to each other, and it was very encouraging and energizing. And for some people, they told us that it felt like they were actually at the meeting, that they were that engaged with each other and the content, that it was a very positive sign.
I want an interactive city too.
Jane, do you have any thoughts?
The same thing everybody else is saying. I think the biggest thing is for a virtual meeting, you've got to have the interactivity available for the learners. Already the content is there already, how we're going to present it, and that kind of thing. That's already there. So I'm very solid on that. Very solid on our posters and abstracts, things like that. Interactivity and access to exhibitors, and then following the guidelines from the ACCME, keeping the learner protected, having the right to choose to go to exhibits or not, that kind of thing. Activity is critical.
So the only thing that I would add is the back end part where staff have to build and creating the program that ultimately is pushed out one way or the other. Functionality, amount of control that the staff actually have. There are some systems where you don't have the choice but to use them to record the sessions versus having a physician film his or her presentation, and that can become problematic. So the back end part is just as important to me. I want to quickly go to the concept of big picture. We aren't all just an annual meeting. We have a whopping 13 minutes. Thinking about how you're looking at all of your education that you're offering right now, what are the changes you're making in your organization as far as education beyond the annual meeting? Deborah, do you want to start with that?
Sure. So as I mentioned earlier, I think looking at the redundancy is an opportunity that we really could focus more on as we go forward. A continuation of the blended learning, again, how we work across formats, work across teams in terms of our colleagues that develop the enduring activities, and what we're doing, which, in these other activities, this other activity format for the most part, how we continue to leverage that. I think also it's planning, this is not going away. This is our new normal. This is the new opportunity we all have in terms of this hybrid virtual reality. I think what we've found is that some of our activities that are converting to virtual are going to stay virtual. That will be their new format. They will not go back to in-person because it's so effective, or it seems to be, or it's designed to be more effective than perhaps what it could have been. And also, again, almost planning with virtual in mind. So as we look across, again, everything, the on-demand, that seems to be a regular theme that we're hearing from our current constituent groups based on our experience, based on our community. It seems like every activity in the future, or many activities in the future, would have some type of on-demand component. And so that's here to stay. And so it's changing our thinking a bit, but it's almost planning for virtual, and especially for 2021, where there's still some unknown, plan for virtual for our conference. And then it's, what would that in-person component be? That's almost the nuance, as opposed to, whereas this year we planned in person and had to flip.
I'll go next. I agree with everything that Deborah said. I think that, when we first came into this era of the pandemic, a lot of our virtual education was very reactionary. It was, what do you immediately need to know because of COVID? How do you transfer a virtual meeting, live meeting to a virtual meeting? So it was all sort of, emergency based. And I think now we have an opportunity, and our committee is really taking the opportunity to look strategically forward. And for us, there were things that we couldn't really properly address at our annual meeting because we have a lot of different diverse groups within our membership that are hard to get in one more general meeting. And so before, the options were to find a way to highlight them in the annual meeting or do a standalone course that cost a lot, and you needed to have a certain number of participants to make it worth it, or you did a virtual meeting that was not in everybody's everyday behavior back then, so you didn't know if you would get any attendees for that either. Now, virtual is a much more regular part of everybody's lives, and it gives us such an opportunity to do things that are low cost and reach new audiences and really zone in on some things that we might not have before because we either couldn't afford it or we didn't think we'd have a big enough audience. So our committee's really been looking, we're starting a whole new series of national grand rounds every month, which really can focus on some specialized topics to bring this specialty together. We're starting a whole new series of spotlight conferences that can really delve into specific topics in half-day or one-day formats and much more affordably. And you can really zone in on some of these things and do some of the interactive formats that are a little bit smaller group that you might not have the opportunity to do in an annual meeting format, but you can do even in Zoom like this, and so I think these are things that we expect to continue beyond the pandemic. I think it's been a major disruptor. This is now something that people are comfortable with, and it's an opportunity, and there are benefits to not having to travel to every meeting that you might want to go to. So there is a positive side, and I think that's what we're looking at. And to answer one of the questions that I saw in the Q&A, I think the virtual aspect of the annual meeting will be here to stay. So we are certainly planning and expecting that we will have that component going forward.
I would say more education outside of science. We were really steeped in, what was going on in abstracts and not really anything else related to that. So we're going to do more in leadership, mental health, health equity, racism was huge, global disparities, more virtual learning for sure. Micro learning, we're going to dip our toes into learning experience design next year. We're also going to really focus on social learning and invest in tech, as well as putting our energy in human resources. My staff was golden, and I'd like to keep them that way. I wouldn't have been able to make some of these sharp turns and pivots without them. I call them my formidable 14 for a reason, and what they've learned, I think in CME, some of it holds true, but I think the landscape has shifted under us, and we need to continue to pour into our staff.
Yeah, I would say the other big opportunity that we see in moving to, a permanent hybrid model, or, however long we stay 100% virtual, is the opportunity for personalization. When people are logging in to view content, you have a much better idea of who's doing what, and you are able to really get an understanding of the kinds of things your learners are interested in, even what the path that they take in navigating your content, which is very hard to do in a live scenario unless you're willing to be very big brother. So, we're excited in exploring that personalization aspect as well, because I think if we are able to push content and really help our learners discover what ASCO has to offer, that's a very different place to be versus waiting for our learners to discover on their own what ASCO has to offer and trying to navigate through all the content that we have.
We're doing a lot with our content. The highlight minutes, if you will, of sessions. We're going to be turning those around. We're also going to be reaching out to other organizations and partner with you to bring some genetics education out there to a wider audience. So we're gonna capitalize on it too, because it is not going away. It's here to embrace. It's here to grow. It's here to learn from, and to make it so that you don't have Zoom fatigue. We're supposed to make it so that you have an education offering that's going to get right to it, and you can get in, get out. And the biggest thing, again, is connection with your peers.
Well, and just to wrap this segment up, we've been growing our online learning portfolio over the last several years, but with this change, we've been able to sort of restructure our staff team. Nina was talking about how dependent we all are on having a good team behind us. So we've just hired a second instructional designer because we had such a backlog of online learning in the queue that needed to get rolled out. If anything, we were finally starting to get to doing more of those small live programs like Rebecca talked about. So I'm kind of anxious to see if we're going to go back to trying to revive those, or if we're going to start converting more of those into virtual events. The one other big change we're making is that we had been preparing this fall to launch finally our formal sort of faculty training certificate program for people who were invited to teach at our live in-person events. And now we're having to pivot there and convert that into how to teach in a virtual distance learning format. So we're preparing our members to continue working in these formats for the foreseeable future, at least.
Right.
I might follow up with you on that, Steve. That's something that our physicians are asking for sure.
Right. Yeah. That is so needed out there by everybody. The speakers in the CMSS today, I noticed, were using some different techniques and things like that, and how they present their material. So it was very clever.
In the last few minutes that we have, could each one of you give just one piece of advice to the people who are taking part of this? What you recommend going forward when you're thinking about this? Just one little piece of advice.
In thinking about what, David? Just in general.
And how to move forward. My piece of advice is take care of your staff, because this is very, very stressful.
Yeah.
I think
I would
network and learn from each other, right? We are all in this together. I saw your comment there, Anne, in the chat. Again, we're all, this change happened to all of us, and some of us were further on the continuum than others. But I think where we can call each other up or email and have a conversation and vet ideas, I think that's really another key piece for me.
I would have to just say, take care of yourself, especially as a leader. I had taken on, even with everything that was going on in the world, I didn't take care of myself the way that I needed to. I took on the pressures of the job, the pressures of the pandemic, my staff, and just kind of kept things moving, but it's not the healthiest thing in the world to do. So, check yourself as a leader and take care of yourself, because in turn you'll become a better leader and be able to make sure that you are taking care of your staff and everything else that you need to do in this really difficult time.
Yeah, my advice would be play the long game. I think when we hit the pandemic, we all went right into reactionary mode, just kind of making decisions on the fly and just, we're just going to do something. And now I think we have the opportunity, even though sometimes it doesn't feel like we can plan it the next month versus have a 3 to 5 year plan. I think we do need to start getting those creative juices flowing again, and knowing that, event to event or course to course, I don't think anybody has defined what right means yet. And so this needs to be an iterative process. We need to be able to feel comfortable learning and growing so that we can really improve at a community level over time.
I would say keep it simple. Just follow all those good, instructional design principles we all know. Focus on the end you're trying to achieve and find the easiest route to get there. Doesn't have to be all the fancy bells and whistles, latest gadget, shiny object thing. Just simple and easy is good.
And I kind of wish that I had gone first, because I wanted to say everything that you guys said. I guess the only other thing I would add is, for me, in terms of self-care, it was helpful to make the mental switch to, this isn't temporary, this is our new reality. this is where we are. And I think that goes to what Anne was saying about the long game. I think once you make that mental switch, it's a different mindset, you know, and it's a different way of looking at things, and then you can start to feel more creative and that to me is more energizing.
All right. Well, unfortunately, our time has come to an end. We've managed not to go through most of our questions, but I think it was a really valuable discussion. And I've discovered more and more the last month or so as we were having these meetings, how much I'm getting from each of you. And I think that we as a community need to be talking, and we need to be talking not only with CPD professionals, but professionals across the board. Our marketing team has to be here. Our meetings team has to be here. Our communications team, we all have to be together and talking, because we are, as was stated, all in this together. I thank you all, and you can count on me reaching out to you. And particularly, I appreciate nobody bringing up pumpkin pie. Thank you very much.